My name is Thamy. I am originally from Haiti. I live in Boston right now. So I consider myself Haitian-American. And I am a midwife by training, but I'm also a professor at Boston College and at Boston University School of Medicine. When I was an undergrad in nursing school, I took a women's health class, just like all nursing students have to take an undergraduate maternity child health class. And I think from my background in Haiti, like my father was working as a doctor in Haiti, so I always have been around the medical field. And I quickly noticed how basically the disadvantages of the Haitian healthcare system. So I always wanted to know that I always knew that I wanted to go back and work at home and help at home. So I went to nursing school, not really figuring out exactly how that would fit into my passion for international work and working abroad. And then my professor from women's health class in college was like, why don't you become a midwife? And I was like, oh, really? And I also met this another student at BC whose father had a birthing center in the southern part of Haiti. So she was like, you need to go and visit the birth center and like see the midwives in Haiti. So I did. And I was like, yeah, I want to do this. So I went to midwifery school. The motivating force behind the work that I do is that I want to help people. I want to make people's lives better. And all around the world, women and children are vulnerable populations. And when women are pregnant, when birthing people are pregnant, that's one of the periods when they're most vulnerable. So that's why, all over the world, birthing people have really high maternal mortality rates. So that's my passion for getting into midwifery. Like I said, I wanted to do international work. I wanted to go back home and work in an environment where things are not always the best. So that's my passion, to just help. I'm just lucky that I'm here, but I could have been anywhere else in the world and have totally different circumstances and been dead already. I have a kid that could have died during childbirth. It could happen to anybody. It's just pure chance. So I just want to use my chance to do something to help somebody else who didn't have the same chance. It's just pure luck. It's home. It's me. It could be my sister. It could be my cousin. Like, that's the joy. It's just that I get to be part of somebody else's experience, somebody else's, big life moment. Like, I get to accompany somebody that could be like me. Like I said, to me, it's like taking care of family. It's not like taking care of family. It is actually basically taking care of family. And I really feel like one of the special joys is that I'm really doing something special, because I know without me, their experience would not be the same. Not that they would have had a bad experience if they had somebody else who wasn't from the same background, but it's not the same. The connection is not the same. The glueness, in a way to put it, is not the same. For me, one of the challenges right now is really helping people to navigate the system, with it being so complex, and especially when they're coming and they're super vulnerable. So what I'm specifically referring to is the recent influx of Haitian migrants that have been crossing the border. So people are traveling from Chile, they're traveling from Brazil, they're traveling from other parts of the Caribbean, by car, by foot, crossing jungles, getting to Mexico. Sometimes their families are getting deported back to Haiti. So the kinds of Haitian immigrant patients that I'm taking care of now are not the same kind. Like before, when people were before, the people that were coming were people that were able to obtain a visa legally and have enough finances saved up to be able to buy a plane ticket, to be able to come. And like usually their stay is planned, they're staying with some type of family for a certain amount of time, and then they're going back home. But now the situation at home is so dire, like people are escaping. And it's not only back in Haiti that the situation is bad, because even people that have migrated to the other countries like Chile or Brazil, the situation in those countries is not good for them either, because they're not able to get papers and work there and grow there. So a lot of them have decided to make that trek across the jungle, crossing multiple countries to get to the United States. So when they're coming, they're refugees. I mean, they have nothing. They have nowhere to stay. They have nowhere to go. They have other kids. They don't have clothes. I mean, they don't have food. So helping them navigate the system to get basic human needs is challenging, and it's painful to see people broken down like that, especially in America. But I think it's different when you know somebody has traveled and sacrificed already so much to get to the American promised land of the free, and then to basically be treated very poorly. Because in our culture, it's not all about business. The personal really matters. So when you have an interaction with a patient, it's not like, okay, I'm checking your blood pressure, I'm checking your baby, and you're good. It's really a conversation, see about how they're, how are you doing? What do you need? And then a lot of times, you kind of become like a figure of trust. Like, people are explaining their deep problems to you, and people are bringing, like, they need your help for a lot of different things. Like I have patients bringing me, bring me their immigration paperwork to help them figure out what UCIS is telling them, which is just things like that in the traditional American healthcare system that people don't think of as medical care, but it is medical care, because if she doesn't answer this letter, she doesn't understand what it says, or they don't understand what it says, and then, they have to be deported, then what happens to their health? She was in labor and she was screaming, and she was saying things in Creole, which, if it's in Creole, it's completely normal. Like, you wouldn't be surprised if you're a Haitian person and you hear people in labor screaming this. But when it was translated in English, it sounded like, I think the word was, she felt like the child was eating her. Like when you say it in Creole, it's like, petite la manger. But she's not referring to the child. She's referring to the pain from childbirth that the child is giving her to come out. She's not referring to the actual child. So I was on call that day, and they were like, we have a team meeting every day to just talk about, to talk about the patients on the floor, what their plan is. And they were like, oh, we don't know if we need to order a psych consult because she's saying that the kid is eating her. Or what is going on? What does that mean? And I'm like, no need for psych consult. It's just how it's translated in English. That's what the literal meaning is, but that's not what the cultural meaning is. I think she just means like, or she was like, the pain is eating her. I forget what the exact word was, but I think she said the pain was eating her. And I think they took that to be like, is she saying something bad about the baby? Is she not going to be able to take care of the baby? Is the baby, like, is she gonna, it was like a whole thing. And I was like, no, this is normal. Like, she's in pain. When she's saying that the pain is eating her, she just means like the pain is so bad. It's so uncomfortable. That's the way she's expressing the pain. Black maternal mortality is such a big problem. It's not a one answer solution to it. It's multifaceted. You have to attack it from different points. Correct? So for example, not something simple, but like, for example, so if I am going to, we know that doulas help improve outcomes, right? Okay. And I'm gonna try to think about Black maternal health mortality and think about doulas as an intervention. I have to think about what type of doulas I'm gonna have depending on the population that I'm taking care of. So if I have a whole group of, like I'm taking care of Haitian women, ideally that person should have a doula that speaks Haitian Creole, just in terms of language. That's why I'm like, it's not a one-dimensional problem. Black maternal mortality is a multifaceted problem. There's many reasons why it's happening. So you can't ignore culture as part of it. And whenever we're talking about culture, you have to think about all the different types of Black people that are getting maternal care in the United States. There's evidence-based solutions that we know help improve outcomes, but you can't implement it the same way everywhere.
Yeah.
Because each community is different. So for me, that's why I'm like, you can't think about doing anything if you're not thinking about the community and the culture of the community you're working in. About if you want your intervention to work well, you can't just put you have to make it fit where it's going to be. Yeah, I would say the first thing is to learn as much as you can about the community. And then definitely, I always try to approach any patient with the basic principles of good humanity, like in a humane way, like, learning about who they are, talking to them, finding out about what they need and how you can support them. Now, what can be hard is if where you're working, the system is not set up for that, which is really not set up for that in any sort of like traditional American medical care system. That's why we have to come up with new and innovative ways that make it easier for us to be able to connect with patients, right? And really take that time, because what you really need in order to be able to care effectively for anyone, but especially somebody whose perspective you may not understand, whose background you may not be from, it takes time to build that rapport. So if you have a 15 or 20-minute OB visit in a busy clinic, that's not enough time. That's not enough time to just get to know them, find out what their fears are, find out what their concerns are, find out what their preferences are, and help them hook up to whatever other resources that they might need. So for example, I work at a health center, and a lot of times people were always on me like, you're running behind. And I'm like, I can't, like, if she's telling me her life story and she's opening her heart to me, I'm not going to be like, I got to go, I have another patient waiting. I have to take my time with every patient, because that's what the job is. That's what is required. If I can't do that, then I don't want to do what I'm doing. I don't want to be rushing people. I don't want to be making people feel like they're just a number. People need that individualized attention where they feel that you care about them. I mean, that's what the research says about immigrants. Like, that personal relationship is very important to people, especially to Haitian immigrant women, because they're trying to navigate the system and get used to this new life in America. You are a figure of trust